And on the line is Dr. Penny Calicott for you, Dr. Ross.
Yeah, medicine's changed dramatically since I trained 40 years ago. The increase of chronic disease has seen many people turn to complementary medical therapies, which has meant the rise of what we call integrative medicine. Now, integrative medicine combines the best evidence-based conventional medicines with complementary medicines to focus on the total health of the patient. Dr. Penny Calicott, who's a good friend of mine, is the president of the Australasian Integrative Medicine Association. I'm delighted to say she's on the line. Good evening, Penny.
Good evening, Ross. Lovely to talk to you.
Lovely to talk to you, my friend. I'm in the throes of just getting over COVID, so the voice is a little bit dodgy at the moment. But anyhow, so when do you think we started to see the move from traditional medicine to the inclusion of complementary treatments?
I think it's been going on for a very long time, Ross. I don't think it's particularly new, except that I think it's now a little bit more recognised and more defined.
Right. So just explain to people, because a lot of people hear the term integrative medicine. Give us your definition of what that means.
Okay. So for me, integrative medicine is understanding the whole picture of the patient. So it's understanding what I call the whole matrix that the patient sits in, from every influence from their birth all the way to where they are now, and also the current kind of environmental influences on that patient's health. And in integrative medicine, we try and understand that person within that greater context and then use the best of evidence-based medicine to address it, including other types of practitioners as well, so doctors, allied health practitioners, and some complementary medicine practitioners as well.
So you and I were both trained in conventional medicine, but as you know, I do practice a fair bit of integrative cardiology. What got you interested in this area?
Well, when I first started in general practice, I started accumulating people with what we now call chronic fatigue syndrome. But at the time, a lot of people felt like they weren't believed by their doctors, and I believed them, but I had to figure out how to help them. So once I started accumulating a number of these patients, I started going to any conference I could on complementary medicine, which I think we called it more complementary than integrative in those days. And started picking up some tools on how to help these people. And then gradually my journey included more and more training and I think it's like every form of medicine, that we never stop learning. And in integrative medicine, we're learning all the time and using whatever we can find that's got a good evidence base and some experience with it, and bring that into play for our patients as appropriate.
Well, I'll just pick you up on something you just said then, and because there'll be a lot of people listening who have this condition. If someone comes into you who says to you, "Doctor, I'm unbelievably tired, I just can't get out of bed, I can't function," and you've excluded the common causes of fatigue, such as iron deficiency, thyroid problems, etc., or just some dreadful acute stress in their life, how do you go about managing that person?
Well, I guess, again, I go back to taking a very detailed, longer history about where they've been, what's happened to them in their lives. As you said, trauma, because as we know, there's a lot of talk now about trauma and post-traumatic stress disorder being involved in lots of chronic diseases. There's never one factor, Ross, is there? There's never one factor that puts people where they are. So we have to understand all the different factors, and indeed the kind of factors that are in play at the moment, like particularly damp and mould, seems to be quite a big factor in contributing to people being unwell at the moment. So really, it's no matter what the patient comes in with, or if someone comes in with fatigue and you can't find the usual things, there'll be a myriad of different factors that affect each individual patient. So it's never a kind of one diagnosis fits all, or one cause fits all people with one diagnosis. It's much more individualised in integrative medicine.
Now, Penny, you and I have been sharing a number of patients for many years. So tell us about the Invitation to Health, which you founded on the New South Wales Central Coast 20 years ago.
Yes, sure. So 2003, we opened this medical centre, and the idea was that it was that it offered a whole kind of health for people, meaning that they could come in and be very well welcomed, listened to, and then treated by a team of practitioners. And it was always important for us that all practitioners who worked within our centre were all considered on a level playing field, that we've all got different skill sets, and that we respect each other's skill sets and then work collaboratively together for our patients. Sorry, go ahead.
I was going to say, you're clearly getting very good results because you're booked ahead for weeks.
Yeah, well, I think a lot of people, we're in a place at the moment where lots of people are unwell but don't necessarily have a diagnosis, and they've gone from place to place to place and specialist to specialist, and sometimes they just don't fit into a particular diagnosis, and so they're looking for other help. And I think also a lot of people are feeling like they don't want to necessarily get a diagnosis and then be committed to medications for the rest of their life. And while they may need some of those medications, certainly we look to try and not only prevent chronic illness, but in some cases at least stabilise or reverse it. And so I think people are looking to integrative medicine for that now, and also feel that kind of safety of having a doctor who's working with other practitioners. So we often get people who maybe have had a bad experience with doctors or with hospitals or with medicine in general, but they'll come and see us because we're working with naturopaths, and they feel almost like maybe they'll get a different kind of hearing, which doesn't mean that we won't do conventional medicine, because that may be what's needed, of course.
And apart from, we've mentioned chronic fatigue, but what are the common conditions that you're managing?
Well, it's kind of everything really that you could think of, but we see a lot of children with all kinds of things. In fact, kids with fatigue, funnily enough, like you wouldn't think that young kids would be fatigued, but there's a whole lot of environmental factors that can contribute to that. We see a lot of mental health issues, so a lot of anxiety, a lot of depression, and more, and other kind of really severe mental health conditions. As you mentioned, a lot of thyroid disease. So like when I started in medicine, autoimmune thyroid disease was, seemingly relatively rare, and now it's incredibly common. In the 1980s, we didn't see a lot of Alzheimer's, maybe older age dementia, but now it's the number one cause of death in women in Australia, which is outrageous. And it's not just the ageing population, because we're seeing younger and younger people get it. So there's a whole lot of environmental influences now on our current generations that we haven't experienced before, because our environment is changing so rapidly. And with the stress, clearly, of the last 2 years, we've definitely seen an increase in all kinds of conditions, but particularly mental illness.
And you're expanding invitation to health to the Northern Beaches as well, and you're looking for practitioners to join your team.
Yeah, so we actually sold our practice at the end of last year. We'd been running it since 2003, but we were very fortunate to sell to a group called Mounties Care. And Mounties Care is very keen to bring this model of practice pretty much into the mainstream by opening practices around New South Wales. And the first one is this practice in Freshwater.
Oh, that's fantastic. So
yeah.
If anyone's interested in, firstly, if any practitioner listening who'd like to be involved, or anyone's listening who'd like a consultation, what should they do?
Well, the practice will be opening. Our opening date is the 8th of August. Fingers crossed that will be already, but if it's not the 8th of August, it will be soon after. And they can certainly contact us through Mounties Care or through Invitation to Health on the Central Coast. And we'd be very happy to talk to them. We've already got a small team of practitioners who are ready to go, which is fantastic, and receptionists, which is they play just the most vital role in our medical centres. And some doctors who are interested. So we're really keen for people who are interested in becoming part of a collaborative care team and who want to work in an environment that's not only supportive for the patients but for them also.
Well, Penny, as you know, I've always been a great supporter of integrative medicine and as I said, practice integrative cardiology myself, so I want to congratulate you on your service in this area and keep up the good work, my friend.
And Ross, I'd like to also congratulate you on your service, because it's so wonderful to be able to send my patients to a cardiologist who practices like you do. It's wonderful, so thank you.
Oh, thank you, Penny. Lovely to talk to you, my friend. We'll talk to you soon. Thank you.
You also. Thank you.